So we're talking today about approaches to developing community wealth building strategies. And this goes hand in hand with a lot of the work we do with organizations, local authorities, NHS trusts, other large not-for-profits in their role as anchor organizations across the UK. And we're going to be reflecting a little bit on what we've heard from some of the learning sets that we run and sharing some initial thoughts with you about what developing a strategy around community wealth building might mean. And language is always the first thing we talk about when we run events like this, because it can be a little bit elastic, and it's just really helpful to check if we're all on the same page. So this is the way we think about some of these different terms. The clue is in the name for HALN. It's the Health Anchors Learning Network. And so many of the organizations, if not all of the organizations who come to our events and engage with the learning sets that we run, are anchor organizations. And what we mean by that is that they are large, mostly not-for-profit or public sector institutions that are a significant enough scale that they can influence local economic development. They have several levers for doing that. Many of them in particular use their procurement and their workforce functions as the two big ones, but some also have really significant estates and infrastructure investment that they can use to influence the local economy. And many are also deeply embedded in their communities. So they are both employers and also partners of communities and community organizations. And we think about anchor organizations as these kind of stable, enduring institutions for whom a kind of more equal, flourishing local community is hand in hand with its objectives, often as an organization that delivers services or runs services in the local area. So many of you today, I can see in the chat, are anchor organizations, are bringing that anchor perspective and maybe at different stages of your anchor journey. Community wealth building is linked to anchor organizations, but we're using it today to describe a broader economic development strategy that's aimed at keeping wealth within local communities and involves lots of different stakeholders, including anchors, but not just anchors, so that it may have a kind of broader political agenda, may have maybe more likely to have a wide range of stakeholders or actors developing their kind of objectives or vision for the city or the town or the county or the borough. So we're kind of zooming out a little bit from the day-to-day of anchor organizations and thinking about this broader economic development strategy. And I know many of our speakers today are holding both those perspectives. They are working in and are anchor organizations and are also thinking about their broader wealth building strategies. It's a concept that originated, I think, in the US, but in the UK for many years, we've had this analogy of a leaky bucket that's often used to describe one of the objectives of community wealth building, so that money that goes into a community doesn't seep out, but it stays in, and we try and plug the leaky bucket. Many of you will have seen this before. This is from the anchor kind of organization perspective. So we're just starting at the kind of organizational perspective. We do, whenever we talk about anchor organizations at HALN, we're always emphasizing that anchor organizations have significant economic power that they can use that has often not been used to its fullest potential in the past. And that's what this kind of anchor lens brings, is this sense of what these huge institutions, often with really significant budgets, really significant workforce, can do to kind of benefit the local economy, the local community, and tackle some of the inequalities at their root. So a lot of this is looking at how we can tackle social determinants of health inequalities at their roots. And here we'll share a link to this tool in the chat, but very briefly, there are just 6 key levers. So for those, I think lots of you on this call will be very familiar with this. This is often also the basis for a lot of metrics that people develop. There's, if I start from the top right, there's the kind of workforce lever. So being an employer of a large number of people and being able to think about being a good employer, the wages that you pay, the opportunities to bring people in who are maybe underrepresented in the labour market in health and care roles, or think about moving people up into higher paid roles and tackling inequalities through workforce or pre-employment programmes is a huge part of this. The second one with the yellow, procurement and spend, again, the huge anchor organizations often have really significant budgets, and just thinking about the way in which we're spending money on pens and paper or turning the lights on in the morning is a really powerful part of being an anchor organisation. And many people have already talked today about their social value policies, about their supply chains, about how they're trying to engage more SMEs in their local areas. So all of that is a big part of that lever. The third lever, the third kind of the lever that anchors have is around their estates and their infrastructure investments. So they often have large estates that can potentially be widened so that there's greater access from community members, and or sometimes they will have some quite significant infrastructure investment projects happening. And those big injections of funding can be a really important opportunity to think about what impact will that funding and that building have on the local community and the local economy. Fourth is a big one around tackling reducing environmental impact and thinking about net zero. Again, NHS has its own strategies and plans to move towards net zero, as do a lot of local authorities, and the impact that anchors can make in that space, both themselves and through others, are really significant. And then the last two are about partnerships, both partnering with other anchor organisations and also with communities. Next slide, please, Sarah. Thank you. I feel very Chris Whitty when I say that. I think our speakers are going to talk more to this, but I guess just stepping out of the anchor, the individual anchor organisation space and thinking about what we mean when we talk about wealth building, community wealth building. There's these four key pillars here, which are really central. So there's as I said before, it's a more explicit economic development strategy that's collectively owned and driven. So we don't necessarily historically think of hospitals having an economic development strategy or housing associations having an economic development strategy, but a place full of partners, full of all of those anchors, can have that community wealth building strategy, that vision of how wealth is kept locally within the economy. Lots of you were talking about assets and community-owned businesses in the Mentimeter, so there's that local control, local economic control dimension, inclusive employment, so thinking about fair wages and good working conditions, using anchor organisations, which we've talked about a little bit on the previous slide, and then local procurement and investment. So thinking about how local procurement can encourage and create more sustainable, inclusive local economies. So those are the key features of community wealth building.